They're not just documentation, they're tools to aid us in thinking.
This is Stepping Up Healthcare. Your host is Tack, and the mission is simple. Build your capability and curiosity to make healthcare better.
Hey there, glad to have you back. In our last couple episodes, we talked about PDSA, Plan, Do, Study, Act. We discussed how improvements happen because we test ideas, learn from them, and adapt. Remembering it isn't a failing as long as you have learned something. But before we start testing changes, there's a question we should answer. Do we actually understand the current process? That's where today's topic comes in, going to the Gemba and drawing the current state. This would be part of the P or plan in PDSA. If you've never heard the word Gemba, it's a Japanese word that simply means the real place, aka the place where the work actually happens. In a hospital, that might be the emergency department, clinic exam room, registration desk, EVS supply closet in the pharmacy, the sterile processing department, or even virtually. Think about how electronic health medical records is the place where the work happens sometimes. Ultimately, the Gemba is where value is created for the patients. One of the biggest mistakes an improvement team can make is trying to improve processes from the conference room. Someone says, "I know how this works," while somebody else says, "That's not how it works." And another person says, "Well, it's supposed to work this way." Suddenly everyone is describing how they think it's supposed to happen. Instead of debating opinions, go and see. Going to the Gemba means observing the work where it happens, with curiosity, not judgment. Think Ted Lasso or Walt Whitman, be curious, not judgmental. And truly, that's not meant to be harsh, like you're judging everything, but try to put your bias aside and see what really happens in the work. And while you're there, you can draw what you see. To be clear, I didn't say a polished flowchart. I said draw. On a piece of paper, on a sticky note, on the back of an envelope, it doesn't matter. The goal isn't beautiful documentation. The goal is to see the connections between the tasks that are part of the process, or to see the processes that are part of a system. As you walk through the process, sketch each step. Who does what information is needed, where are the decisions made, where do interruptions occur, where do people have workarounds. You're creating a picture of reality, not a policy, not a procedure, not even standard work. And I say that last part, not policy, procedure, or standard work, because you are drawing what you actually see, not what should happen. It takes some humility and understanding to do that, but that is your current state. That is the baseline.
Why does it matter?
So why spend time drawing? A couple of reasons. One, because our brains are not always reliable in remembering processes accurately. We might remember highlights, exceptions, or what should happen, but healthcare work is complex. Once again, no duh. Even something that seems simple to an outsider, like discharging a patient, might involve nurses, physicians, case management, pharmacy, EVS, transport, and the patient themselves. Each of these people only sees part of that system, part of that large process. Drawing helps everyone see the whole thing, the whole system. You're able to see those connections, pathways, and handoffs. Number 2, improvement happens at the process level. People can think they have a communication problem, a staffing problem, technology problem, etc., and sometimes they do, but many times those issues are symptoms of processes. When you draw the current state, hidden problems become visible. Quite literally, you are drawing them out. You are making a physical picture of them. Once it's drawn, you might notice unnecessary loops, duplicated documentation, multiple approvals, long periods of waiting, frequent interruptions, or places where staff have quietly invented workarounds just to get the patients what they need. Those workarounds are especially interesting. They're often signs that the process isn't supporting the people doing the work. We might not be setting those folks up for success. And lastly, drawing creates alignment. Instead of everyone carrying around their own mental model, the team now has one shared picture. Silly example, if you told 10 people to draw a cat, you would probably get 10 different looking cats. The main concept of a cat is understood by just about everybody, but the details are different per person. That's also a fun little activity to do, even just an icebreaker, to show the variation per person. So once everyone aligns on the current process, then, and only then, you can begin discussing how do we improve it. You've got to build that rock solid foundation, that alignment on where we're starting from. It's really difficult to improve something that no one sees the same way. Think about that episode from the beginning of the season about problem statements. The exact same thing. We're trying to define what is the actual problem we're trying to solve.
Let's talk about some real-world examples.
Imagine a primary care clinic that struggles with long patient wait times. Let's say leadership assumes providers are running behind schedule. The providers think registration is slow, and registration thinks medical assistants are taking too long with the patients. Everyone has a theory. Instead of guessing, the improvement team goes to the Gemba, goes to the real place. They observe several patients' visits from arrival to checkout. As they draw the process, they notice something unexpected. Patients are actually getting roomed fairly quickly. The biggest delay happens after the MAs finish intake. Providers don't always know that the patient is ready because different staff communicate readiness in different ways. Some use the EMR, some use the little flag outside the exam door, some send secure messages or page the provider, some simply wait until they see a physician walk by. Back to season 1, we talked a little bit about variation and the 8 ways. As we draw it out, we see the forks and loops in the process map. We see the waste. Nobody intentionally designed these variations. It just evolved over time, or maybe everyone was trained differently, and then we just had all of these different permutations and these slight changes. Without drawing the current state, without going to the Gemba, the team might have spent months trying to improve provider efficiency, when the real opportunity was standardizing one communication step. Next example, a hospital wants to reduce delays in medication administration. The initial assumption is that pharmacy's turnaround time is just too long. But when the team observes the work, they discover medications often arrive on the unit fairly quickly. The larger issue is that nurses are frequently interrupted while preparing meds. Phone calls, preceptor questions, equipment issues, family requests, documentation, whatever it might be. Each interruption only adds 1 or 2 minutes, but over an entire shift, they create significant delays. Again, the current state drawing changes that conversation. Instead of blaming one department, everyone sees the system contributing to that outcome. A personal example, I've sat with the OR charge nurse to observe what her rounding looks like. By the end of the observation, I had a stick figure with about 8 or 9 arrows pointing in or out or away that represented phone calls, scheduling, equipment issues, etc. And one arrow or one workflow that was actually rounding on the OR rooms and checking in on staff. The charge wasn't slacking on her responsibility, as perceived by some of the OR staff. She was actually managing distractions and other work as best as she could. Last example. Imagine you're improving the employee onboarding process. In this example, no patients involved directly. Just human resources, IT, facilities, department managers. As you draw the process, you realize new employees enter the same information multiple times into different systems. Nobody intended to create that waste. It accumulated over years as new software was added, and we, as I like to call it, Frankensteined our system. We're adding parts from all over, all together into one, and just kind of putting them together like Frankenstein's monster. Drawing the process reveals opportunities that no single department could have seen all by themselves. Healthcare is so siloed, and it's very easy to blame others when you can't see, quite literally, the whole picture. Occasionally I have an idea that rattles around in my head, and I can't eat, sleep, or breathe without thinking about it. Think an earworm like a song that just gets stuck in your head, but it's an idea. One was a soundbite I heard a while back and has been kind of in my head ever since. The thought is, drawing is an international language. We talk about music being an international language. I think drawing as well. Long before we even had written words, humans used drawings to communicate. Think about early cave paintings. Our ancestors used simple images to tell stories, share information, and make sense of the world around them. Thousands of years later, we still rely on visuals to communicate complex ideas quickly and across a variety of different languages and cultures. A simple sketch, symbols, or diagrams can often convey meaning in a way that words alone cannot. That being said, you don't need to be an artist. You don't even need fancy software. Simple boxes, arrows, stick figures, circles, whatever it might be. Even rough sketches communicate ideas in ways that paragraphs upon paragraphs just often can't. Imagine walking into a room where someone has covered a whiteboard with current state drawing. Within seconds, you begin to understand the process, at least at a high level. If instead someone handed you a 5-page written description, it would take you much longer to build that same mental picture. Visuals can help reduce ambiguity. They can create shared understandings faster. This is especially important because some people are naturally visual learners. Now, personally, I draw something well before I start writing about it. When I see a process, I can notice patterns. Together, we can spot bottlenecks. We can recognize unnecessary movement. We can identify repeated steps. In general, our brains are fairly good at finding patterns once they're visible. That's another reason why process maps can become so powerful. They're not just documentation, they're tools to aid us in thinking. And that's wildly important. The drawing isn't necessarily the goal. It's the conversation, thinking, and learning that happens around the drawing that is the most important part. We are building that current state. We are building the alignment on where we are starting.
Homework time.
All right, here's your homework for this week. Choose one process you interact with regularly. As always, keep it pretty small, whether it's scheduling an appointment, processing a referral, rooming a patient, even requesting PTO. That could be an interesting one. Now, resist the urge to sit at your desk and draw it from memory. Instead, go to the Gemba, watch the work happen, even if it's virtual. Thinking about that PTO example. As you observe, sketch the process. Don't worry about making it pretty. I'm not asking you to be the next Banksy or paint me the next Mona Lisa. You're not creating artwork. You're building understanding. When you're finished, find someone who knows the work and ask, is this an accurate picture of what really happens? You might be surprised what they add or what they erase, or if they laugh because that's not actually how it works. Hopefully there's some valuable learning in that, and maybe just a little fun. Alright, that's all I've got for you today. next episode is going to be about root cause analysis, getting to root. We're going to talk a little bit about the tools, but more about why we need to get to the root. Shameless plug, make sure you check out my YouTube channel and check out some of the exclusive content on there. But until then, I'm Tack, you're appreciated, let's step up healthcare.